Hi, I'm Sireesha Yadlapalli, CEO of Pharmatech Associates, a USP company. And before being CEO of Pharmatech, I was a staffer at USP. I have been with the USP family for a decade now. 3 of those years have been with Pharmatech Associates, which is a subsidiary of USP. But here I am today talking to our CEO of USP, Ron Piervincenzi. So thank you, Ron, for taking the time to be here with us.
Thank you, Sireesha. It's a pleasure, and I couldn't think of something I'd rather talk about than the role Pharmatech plays at USP.
The last 5 years have been very eventful for the industry overall. And there's a lot that's happened. The pandemic showed us a lot of vulnerabilities in our supply chain. Governments are thinking about where is it that manufacturing happens for drugs, and science has been evolving constantly over this time with great speed in biologics, cell and gene therapies. With all that happening and the environment changing so rapidly, how has USP adapted to being that steward of quality in this environment?
Yeah. I think to be fair to those who come before us, life has always been complicated and evolving. And so I do think there have been some extraordinary moments recently, but I'm also realizing that I think everyone feels that in their time. And looking at USP's history, we see that. And so more than I think that we've had more change, it's just that there's been like step ups in sophistication. USP, to be committing to our mission, unchanged mission around medicine quality, has required us to go from sort of the on-demand, this is how you measure quality, to something much, much more proactive. And I think that's the fundamental shift that's occurred. And then all the things you described have just accelerated that.
So let me ask you about resilience. As we think about resilience, it seems to have shifted from what operationally a drug manufacturer or developer was concerned about to something that governments are thinking about, policymakers are thinking about. So Ron, what do you think we have learned about the vulnerabilities of U.S. medicine supply chain?
Yeah. So we have learned quite a bit. And I think one thing we learned is people have gotten used to a pretty good drug supply. They've gotten used to a drug supply that is almost always there when they need it. And it's gotten good enough that when something goes wrong, people really notice. The glass half full is you had something good enough that people notice when it got disrupted. Okay. But disruptions do occur. And disruptions in medicine, in critical life-saving medicines, cannot be acceptable. And so the real challenge isn't that the medicine supply chain is highly vulnerable. It's that we have a medicine supply that we can't allow to be vulnerable. We can't allow to be vulnerable because medicine is so important.
We know that developing a promising molecule is a challenge, right? But what becomes really complicated and a much bigger challenge is when you have to build a commercial process, build a manufacturing process that actually is scalable all the way to commercial, that it has the analytics that run it consistently and it's scalable all the way to commercial. And they have to follow modern quality principles because then you have to ensure product quality, you have to ensure global regulatory compliance, and you're trying to ensure reliable patient supplies. So with all of this, there is a capability issue that comes up. So what challenges are you hearing from manufacturers when they are thinking about translating the standards into actionable practice?
Yeah, and I think, Sireesha, that this is also links back to one of the first things we spoke about, which is that the drug supply has gotten more complicated. I don't mean global, but I mean just drugs in a positive way are more complicated. There are more kinds of medicine, all kinds of modalities. And every time you have more and more modalities, it stretches the definition of, well, how do I ensure the quality of this entirely different kind of medicine? And that falls on the individual companies who are doing these innovations, who are creating these new, more complex therapies, especially, but not only, in more complicated advanced therapies and biologics. And so in those spaces, they have to answer not only how do I define quality for this particular medicine, but then how do I make sure I can define that for the global marketplace to regulators around the world. Now, standards play an incredibly important role. And when there's more differences, standards can become more important, but they're not sufficient. And we know this is not new news to us. Regulators know the same. But how do we bridge that gap? And now there are thousands of companies around the world creating all sorts of novel medicines. That's a high degree of coordination. And this is where, Pharmatech comes in, is to help us translate this complex world of many, many kinds of medicines, many, many companies, to a smaller but not insubstantial number of standards, to then get to a more also smaller but still not insubstantial number of regulators for acceptance. That's a lot of work. And so really good thinking of people who can translate that to action in a specific environment, I think is really important.
And what we see on the ground, Ron, is while most people agree on what does it mean to implement quality standards in terms of, yes, quality standards must be adhered to all the way from development through commercialization, through all the stages, translating that into actual practice is where things get complicated. Is that the reason? Was that part of the reason for the acquisition? What was the strategic thinking behind acquiring Pharmatech?
Yeah, it's 100% that. In fact, it was seen as an unmet need. Like, we identified it as a gap.
So do you believe then that Pharmatech is strengthening some of USP's impact today, and how?
So, two ways. Yes, in two ways. Yes, first, and maybe the more obvious one, is that we're doing big, complicated things with standards that are intended or have to be applied to everyone. Clearly, it means something a little bit different to every company, even every product in some cases, and there's work to be done there. And that's something that Pharmatech can directly help in. And that helps USP's mission, which is to have a supply of quality medicines. Can't get more direct than that. There's something slightly less direct, which is maybe just as powerful, though, is what USP learns from Pharmatech's work. When Pharmatech does that detailed, specific work and brings back information that helps us to determine what else we could be doing, how could we be changing our work, what new standards in the future can we be working on, it's an amazing set of intelligence that we also ask of industry directly, and we have mechanisms to receive that because our new standards can only be as good as the people who partner with us. So those are two ways we have impact. One is the most direct, but that second one is really important.
USP's credibility has been built upon trust.
Yeah.
And a lot of that trust is based on that independence of the standard setting process. Now, as USP is expanding beyond standard setting to help manufacturers implement some of those standards, like through the acquisition of Pharmatech, how are you maintaining that independence of the standard setting process side of USP?
Yeah, so we don't maintain anything. I like to say is that we build it, and you build it every year. And so the way you be able to have it is you continue and nurture it. But the independence is the standard setting process itself is not swayed by individual components, and is done based on the collection of the data, the best available scientific knowledge, regulatory science available. So when it comes to Pharmatech, we didn't have to invent anything new. We said, okay, so Pharmatech is going to be an independent entity within USP, and it is. It does not involve itself in any of our standard setting at all. That's very easy. It's zero. But in the rest of USP, about how we work and how we collaborate and how we feedback the information, it's a fantastic opportunity. And as I say, it's like an accelerated version of what we do, speaking directly with a regulatory authority or directly with a company about their experiences, taking those learnings back in.
Moving to one of the most exciting developments in the industry, Ron, is been the biologics modalities, the new modalities like cell and gene therapy and other advanced therapies, which are really bringing about new possibilities for unmet patient needs. With that also has come a lot of complexity. Biologics has different complexities, maybe more complex than small molecule when it comes to process variability, scale-up challenges. It has unique issues. So as the excitement about new cures, possible cures comes through, and we have this complexity, I understand why biologics is a central focus to USP, but could you explain what's the forward-looking strategy for biologics and advanced therapies as of right now?
Yeah, it's very good how you described it. And I think part of the challenge is that there really is no such thing as biologics. There are a dozen different kinds of biologics. If you think about your comparison to small molecules, it's each one of them is different than small molecules. And sometimes they're more complex in different ways. But the key here is that there are many, many different kinds, modalities of medicine. from a quality lens, this is enormously important because each of them has to be adapted to those standards, what we expect of quality in different ways. That adapting requires more flexible standards, and that's what USP is working on. These flexible standards are essential and important, and we have great support from industry and regulators for the creation of these more flexible standards because they're necessary in biologics. That's a good thing. However, a more flexible standard is less prescriptive, obviously, by definition, and therefore the company using them has to do more to be able to make sure it can fit for their individual development program. And that step requires work and thinking. It's the complexity part of biologics and advanced therapies like you described. And so that additional effort is worthwhile, it's important, and I think it's a place that I would like us, and especially Pharmatech, to do more to help us bridge that gap.
Flexible standards, definitely something that we have been hearing the need for from the industry. So it's great to hear about USP working on it and it being priority. And at Pharmatech, we are definitely seeing a lot more biologics customers need those kind of services and focused on process variability or complex analytical methods, which again come back to strong suit of USP. And now with Pharmatech, the implementation engine really there to provide that service to our customers. So with that, it brings me to the question of, as biotech leaders and others watching this conversation, for example, as they begin to build what might be their first manufacturing unit, what advice do you have for a biotech CEO?
It's a great question. Especially startups and smaller companies maybe don't realize that eventually they're going to have to prove their worth to a regulator, of course, but also perhaps to a partner, a larger company, or even just investors who start to ask questions about their readiness to ensure quality during a manufacturing scale-up. It's not a small item in the ultimate sort of value and expectations of success, and yet all the data shows that it's a very, very common hiccup. Even if you look at mergers and acquisitions of entities, you'll see often delays associated with not meeting certain parameters around CMC, quality, things that are often manifested in and around early development. It's not that surprising, but it is pretty clear, the data. And it is to some degree avoidable. Nothing's perfect, but you can be more proactive, as we've described. What we're trying to focus on at USP and our standards, and what Pharmatech is doing in its portfolio of services, is to focus on the ones that matter the most, that make the biggest difference, that are the hardest also. And in having those to an organization that maybe has never done this before, that they don't have that expertise, and this is a way to get them over that line so that that product can get to patients in a quality and reliable way. And I could kind of finish up with, as an expertise, this isn't meaning that Pharmatech is able to do services on everything. We're pretty focused. We're talking about a certain area that is very much in alignment with USP's mission. Of course, that's not a coincidence. But also within that, we're focusing on the problems that matter the most, that make the biggest difference, because that's what we've heard from the industry. That's what they want. That's why they want the help. And they'll tell us hey, we've got that. That's okay. We don't need your help there. We need it over here instead.
Another interesting aspect of what's going on in the industry, which nobody can miss really, is the advent of artificial intelligence, digital modeling and innovation being adopted by customers and manufacturers at the moment. How is USP really gearing up and rising to provide solutions to manufacturers as they are adopting new digital technologies?
Yeah, so a few ways. If I could say, our AI strategy. First, like I think everybody on Earth, we have to think about how we can use it in ways that are effective, responsible, and advance our mission. And that can come in lots of flavors, like for many organizations. More interesting are the next couple. So the second one is, how are the people who use our standards using AI to make sure that our standards will work in the new ways they're working? How are they deploying AI in their manufacturing systems and their quality control? It's early days yet, so the answer is not much, but it's starting to happen. And we want to be there and make sure that our standards not only apply and are useful, but are, if anything, helping them to get the best value and to improve the quality of their own systems. And then there's, I think, a third way is that AI itself creates a way for USP to get our quality into the manufacturer's systems itself more directly. So how can we apply AI in our solutions and help laboratory equipment, for example, be able to analyze and give you a quicker and better answer without the uncertainties and the mistakes that can happen otherwise?
Thank you, Ron. Thank you for your time, and thank you for all the work that USP is doing to strengthen medicine supply.
Thank you, Sireesha, and congratulations to you on helping Pharmatech be such an important part of USP.